In 2013, many communities in the northeastern states of Yobe, Borno, and Adamawa of Nigeria came under severe attacks from extremist armed groups. Despite the federal government's effort in declaring a state of emergency in affected states, the attacks did not reduce. Rather, the continual wave of mass destruction, brutal killings, abductions and displacement of a large mass of population from their homes still persisted. These attacks resulted in massive destructions of public facilities and infrastructures in the affected areas. A typical example of the current situation is what remained of the formerly expansive local government area offices in Machika after insurgency attack and occupation. People's sources of livelihood were completely destroyed. Their homes and belongings were burnt down. Farmlands, which remain the core of the people's occupation, have been laid bare. Many of the farmlands are believed to have been mined and may constitute death traps to potential farmers. Current statistics reveals that over 9 million have been affected in the 3 states of emergency and its environs. 1.5 million persons have been displaced. 52% of IDPs are women and girls. 56% of IDPs are children, with half of them under the age of 5. 92% of IDPs live with host families, while 8% live in camps. From the assessment of Oxfam and its partner, the Civil Society Coalition for Poverty Eradication, CISCOPE, the impact of these crises has led to serious humanitarian needs, including food needs, poor access to water, poor hygiene and sanitation, lack of shelter, health situations, and psychosocial trauma. The number of displaced persons has continued to rise above the host population, without basic necessities to support the population, especially the women, children, and the elderly. Since May 2014, Oxfam, funded by ECHO in collaboration with its local partner CISCOPE along with other agencies, have been intervening in the north of Adamawa, Yola, and its environs, providing support in host communities, informal settlements, and formal camps. In the first phase of Oxfam's intervention, over 25,000 beneficiaries were provided with food assistance, comprising rice, maize flour, beans, and palm oil. In addition, they received jerry cans, hygiene and laundry soaps, sanitary pads, blankets, and mosquito nets. Water treatment tablets were also made available to improve access to clean water. There were very few latrines, and most resorted to open defecation. To address this, over 50 latrines and bath spaces were constructed in various settlements. Hygiene promotion also formed a major part of discussion with the IDPs. This was reinforced by the dissemination of health messages and hygiene kits to avoid outbreak of major diseases. By April 2015, about 94,000 displaced persons and host families in host communities, camps and informal settlements had benefited from Oxfam's efforts. With the counterinsurgency and reclaiming of areas that were otherwise occupied by insurgents, IDPs have started returning to their areas of origin. Apart from high humanitarian needs in the areas of return, the majority of these areas are not yet safe to return to. But several IDPs are returning due to a poor level of support in their areas of displacement, while the majority of the IDP farmers want to take advantage of the raining season to farm in their areas of origin. Though renewed efforts by government have continued to dislodge the insurgents, resulting in the liberation of thousands of captives, especially from the Sambisa forest enclaves, the humanitarian challenges have continued to increase.